Have you ever looked down at your feet after a long day and wondered why they feel like balloons? You're not alone. Swollen ankles and feet are a common issue among seniors, and while they might seem harmless, they can be your body's way of telling you something's off. Whether it's poor circulation, fluid retention, or something deeper, you don't have to live with the discomfort. In today's video, we're diving into 10 effective remedies for swollen ankles and feet that are backed by real science, practical advice, and tips you can start using today. Stick around, because by the end, you'll know exactly what steps to take to reduce swelling, improve your mobility, and feel like yourself again. Elevation, the simple gravity trick that works. When it comes to reducing swollen ankles and feet, one of the simplest and most effective methods is elevation. This technique relies on the power of gravity to help reduce fluid buildup in your lower extremities. As we age, the veins in our legs may not work as efficiently as they once did, especially if we spend a lot of time sitting or standing. Elevating your feet above heart level helps the blood and lymphatic fluids return toward the upper part of your body, preventing pooling and swelling. Experts recommend propping your feet up on pillows while lying down, ideally for about 15 to 20 minutes, several times a day. It's important that your legs are actually above your heart, not just on a footrest, so that gravity can do its job. A study published in the Journal of Clinical Nursing found that regular elevation significantly reduced leg edema in elderly patients, especially when combined with other therapies like compression or light movement. The great thing about elevation is that it's easy to do at home. Watching television. Put your feet up. Reading a book. Grab a couple of cushions. Even better, try to incorporate this into your bedtime routine, lying flat with your legs resting on stacked pillows. This helps reduce morning swelling and improves circulation overnight. If lying flat is uncomfortable due to back problems, you can also elevate your feet while sitting in a recliner. Just make sure your knees aren't bent at sharp angles. This method can also be paired with slow ankle rolls or toe flexes while elevated, which can boost circulation even more. Over time, consistent elevation not only helps manage swelling but also promotes better blood flow, reduces pressure on the veins, and provides much-needed relief for tired, achy legs. It's low cost, low effort, and low risk, making it a perfect starting point for anyone dealing with chronic foot or ankle swelling. Compression. How the right socks can change everything. Compression therapy has been around for decades, and for good reason, it works. For seniors struggling with swollen feet and ankles, compression socks or stockings are one of the most effective tools available to reduce swelling and improve circulation. These specially designed garments apply gentle pressure to your lower legs, which helps blood flow back toward the heart and prevents fluid from pooling in your feet. When you put on compression socks, you're essentially giving your veins a boost, helping them fight against gravity and keep everything moving the way it should. Research in the Journal of Vascular Nursing supports their use, showing a clear reduction in swelling and discomfort, especially in older adults with chronic venous insufficiency or those who spend long hours seated. What makes compression socks even more appealing is how simple they are to use. Just put them on like regular socks in the morning and go about your day. However, choosing the right compression level is key. For mild swelling, a light compression level of 15 to 20 mm of mercury may be enough. For more significant edema or conditions like varicose veins, a higher level of 20 to 30 mm of mercury might be recommended by a doctor. It's important not to go overboard without medical advice. Too much compression can actually cause discomfort or cut off circulation if not fitted properly. Many pharmacies offer fittings or guidance on which type is best based on your specific needs. Another tip is to put them on first thing in the morning, before any swelling has had a chance to settle in. This way, the socks can prevent the problem rather than just try to fix it after it's happened. They come in various styles now too, not just the old, thick hospital-grade ones. You can find knee-highs, thigh-highs, and even compression sleeves that look like regular socks or leggings, making it easier to wear them in public without drawing attention. Some are even designed with breathable materials and moisture-wicking fabrics, so your feet stay comfortable throughout the day. If you've had bad experiences in the past with tight or itchy compression wear, try newer brands that focus on senior comfort. For those with arthritis or mobility issues, tools like donning aids or zippered styles can help make getting them on easier. Consistency is crucial here. Wearing them daily and taking them off at night helps manage swelling long-term, especially when paired with elevation or movement. Think of compression socks as your silent partners in foot health: quiet, consistent, and incredibly effective when used the right way. Movement and gentle exercise. Keep the blood flowing. One of the most overlooked yet powerful remedies for swollen feet and ankles is gentle movement. Staying active helps your muscles push blood and lymphatic fluid through your body, which can stop it from pooling in your lower legs. When we sit or stand still for long periods, gravity pulls fluid down into the feet and ankles, and without movement, it tends to stay there. This is especially true for seniors, who may not be as active due to mobility challenges, arthritis, or simply because routines have slowed down. But the good news is that you don't need to run marathons or do anything intense to see real results. Even light movements like ankle circles, seated marches, and slow toe lifts can make a big difference. The key is consistency and repetition. A study published in the Journal of Aging and Physical Activity found that seniors who performed light, daily lower limb exercises had significantly lower rates of edema compared to those who remained inactive. These exercises help activate the calf muscles, which act like a pump to move blood upward through the veins. One simple routine is to sit in a sturdy chair, raise your toes while keeping your heels on the floor, then reverse the movement. This strengthens circulation in the feet and ankles and helps move fluid back toward your heart. If you can stand comfortably, walking is one of the best things you can do. Try taking short walks around your home every hour, or walking in place during television commercials. Even 10-minute walks after meals can help digestion and reduce swelling. Swimming or water aerobics is another great option if you have access to a pool. The water supports your body and reduces joint strain, while also providing gentle resistance that boosts circulation. Yoga is also helpful, especially poses that lift the legs or involve gentle stretching of the calves. Chair yoga can be an excellent starting point if floor work is difficult. Always consult with your doctor before starting a new routine, but don't underestimate the power of small, daily movement. The goal is not to exhaust yourself, but to keep things flowing. The more you move, the more you help your body do what it's designed to do. It's also important to listen to your body. If your legs feel heavy or achy, it might be time to pause and elevate, then resume movement when you're ready. Keep in mind that movement also helps prevent more serious issues like blood clots and deep vein thrombosis. Swelling might seem minor, but it can signal something more serious if left unchecked. Moving often, even just a little, is one of the safest and most accessible remedies available. Hydration and a low-sodium diet. Balance fluids the right way. One of the most surprising things about swollen ankles and feet is that sometimes the cause isn't too much fluid, but too little. When the body is dehydrated, it holds on to water to protect itself, often storing it in the lower parts of the body like the feet and ankles. That's why drinking enough water every day is one of the simplest and most important ways to manage swelling. Water helps flush out excess salt, supports kidney function, and keeps your blood circulating properly. Seniors are especially at risk of dehydration because the sense of thirst weakens with age, and medications can also affect fluid balance. According to the National Institute on Aging, older adults should aim for about 6 to 8 cups of fluid a day, and even more in hot weather or after physical activity. This doesn't mean just plain water. You can also include herbal teas, broths, and water-rich foods like cucumbers and watermelon. At the same time, cutting back on sodium can make a huge difference. Salt causes the body to retain fluid, and even small amounts can add up if you eat processed or packaged foods regularly. Canned soups, frozen meals, deli meats, and restaurant dishes are often loaded with sodium, even if they don't taste salty. The American Heart Association recommends no more than 1,500 milligrams of sodium per day for older adults, which is about 2/3 of a teaspoon. Start by reading food labels closely and choosing low sodium or salt-free options when available. Cooking at home more often is another great way to control salt intake. Use herbs, lemon juice, garlic, or vinegar to add flavor instead of reaching for the salt shaker. Potassium-rich foods like bananas, sweet potatoes, and spinach can also help counteract sodium and support healthy fluid balance. In fact, studies in the Journal of Nutrition have shown that higher potassium intake can lower blood pressure and reduce the risk of fluid retention. If you're on medications that affect your kidneys or heart, always talk to your doctor before making big dietary changes, especially regarding potassium. It's also worth remembering that staying hydrated doesn't mean drinking all your fluids at once. Spread them out through the day, starting with a glass of water first thing in the morning. If you tend to forget, keep a water bottle nearby or set gentle reminders. You can even use a large container to track your intake throughout the day. Staying hydrated and reducing salt is not just good for swollen feet, it supports your heart, kidneys, and overall health. It's a natural, no-cost remedy that gives you more energy and helps your body work better from the inside out. Massage and lymphatic drainage help your body move fluids naturally. Massage is more than just a relaxing treat, it can be a powerful tool for managing swollen ankles and feet, especially for older adults. When done correctly, massage helps move trapped fluids out of the tissues and back into the bloodstream, encouraging your body to process and eliminate the excess more efficiently. One method that's especially effective is called lymphatic drainage. This gentle massage technique focuses on the lymph system, which plays a key role in clearing waste and toxins from the body. When the lymph system slows down, fluid can build up, especially in the lower legs. A light, rhythmic massage directed toward the heart can help stimulate these vessels and move fluid along. Research published in the Journal of Gerontology found that regular lymphatic massage reduced leg swelling and improved comfort in older adults dealing with chronic edema. The best part is that many basic techniques can be done at home or with help from a caregiver. For instance, you can start at the toes and gently stroke upward along the feet, ankles, and calves using smooth, circular motions. Always move in the direction of your heart and use just enough pressure to move the skin, not press deep into the muscle. If you're massaging yourself, it may help to apply lotion or oil to reduce friction and make the movement smoother. You can also use tools like soft rollers or massage sticks, which are easy to handle and don't require much strength. These tools help improve blood flow and can even break up tight areas that may be contributing to stiffness or swelling. Another option is to book a session with a licensed massage therapist trained in lymphatic drainage or geriatric massage. They understand how to work with delicate skin and circulation issues common in seniors, and they can offer personalized advice based on your specific condition. If going out is difficult, some therapists even offer in-home visits. Massage can be especially useful when paired with elevation or after a warm bath, as heat naturally relaxes the tissues and makes fluid movement easier. Consistency is key here. Even short, daily massages of 10 to 15 minutes can make a noticeable difference over time. You can also ask a loved one or caregiver to help, especially if you have trouble reaching your feet or legs. Don't forget that massage helps more than just swelling. It also increases circulation, eases pain, and supports relaxation, which can improve sleep and reduce stress. For seniors with diabetes or sensitive skin, always check for open sores or irritation before beginning, and avoid massaging directly over varicose veins or areas that feel hot or inflamed. Always consult a healthcare provider if you're unsure whether massage is right for you. When done mindfully and regularly, massage becomes a safe, simple, and natural remedy that helps your body take better care of itself. Herbal remedies and natural anti-inflammatories. Nature's helpers for swelling. Nature offers many safe and effective ways to support the body's fight against inflammation and swelling, especially in the feet and ankles. Herbal remedies and natural anti-inflammatory ingredients have been used for centuries to ease discomfort and support circulation, and many of these options are especially helpful for older adults. One of the most well-known natural remedies is ginger. Ginger contains compounds called gingerols that have strong anti-inflammatory properties. Drinking ginger tea daily or adding fresh ginger to your meals can help reduce swelling from the inside out. A study published in Phytotherapy Research found that ginger extract significantly reduced inflammation markers in people with chronic joint conditions, making it a promising option for those with arthritis or circulation issues. Another helpful herb is turmeric, which contains curcumin, a powerful anti-inflammatory compound. Curcumin works by blocking enzymes that trigger inflammation and can help ease pain and reduce fluid buildup. You can find turmeric in capsule form or use it in cooking. Pairing it with black pepper improves absorption, so try combining them in teas, soups, or smoothies. Dandelion root is another herbal option that acts as a natural diuretic, helping the body get rid of excess fluid. It also contains potassium, which helps balance electrolytes and supports kidney function. Sipping on dandelion tea can gently reduce swelling without the harsh side effects of prescription diuretics. Parsley, though often just seen as a garnish, also has diuretic properties and can be used in salads or blended into green juices. For external relief, consider using Epsom salt foot soaks. Epsom salt contains magnesium sulfate, which can be absorbed through the skin and helps draw out excess fluids and reduce inflammation. Fill a basin with warm water, add half a cup of Epsom salt, and soak your feet for 15 to 20 minutes. This simple routine not only relieves swelling but also eases soreness and promotes relaxation. Essential oils like peppermint, lavender, or eucalyptus can also be added to foot baths or massage oils to improve circulation and calm the nervous system. Always dilute essential oils in a carrier oil, like coconut or almond oil, before applying them to the skin. While herbal remedies can be powerful, it's important to approach them with care. Not all herbs are safe for everyone, especially if you're taking medications for blood pressure, diabetes, or heart conditions. Always check with your doctor or pharmacist before starting new supplements or teas, especially if you take medications that affect your kidneys, blood pressure, or blood thinners. Stick to trusted brands and avoid anything that makes big promises or seems too good to be true. Herbal and natural options work best when used consistently and combined with lifestyle changes like elevation, compression, and hydration. These remedies offer gentle but real relief and give your body extra support in its effort to reduce swelling and stay balanced. Over time, these natural helpers can become a trusted part of your wellness routine, offering comfort without adding more strain to your system.